Well, hello everyone. My name is Duane Mays and I'm the Director for the Division of Senior and Disability Services. It's one of 8 divisions that currently reside within the Department of Health and Social Services. So before we get into the meat of this presentation, I want to talk to you about who we are as a division. And I'll start with the term long-term support services. So when you think of that, in our division we have what we refer to as our home and community-based services program. And this is supporting our seniors, people with disabilities, our vulnerable populations to remain integrated within their communities as much as possible at a cost that is fairly insignificant to us as a state. So that's the key to remember. Our home and community-based services program is all about integrating people within their communities where they can remain in their homes or in an assisted living home or in a group home if that's their choice. So that's the dynamic that we within the division live by. We also have our personal care attendant program, which is roughly around $100 million a year. And this is supporting primarily seniors to remain within their homes. They may struggle in terms of self-care. There are certain things that they cannot do. They may struggle with just keeping up their home. They cannot do that because of physical limitations or disabilities. And so the personal care attendant program brings in a caregiver into that community or into that home and supports that individual in terms of what their needs are. So that's who we are, home and community-based services and personal care attendant services. That's the primary focus of our division. So in saying all of that, we all know that there is a crisis right now in terms of our budget. We have taken some reductions. All divisions, all departments within the state system have experienced that in the last year. And there are more reductions to occur going forward. That's the reality of the price of oil. We all know that oil is down significantly, and that really drives the state budget. So we're challenged by that in terms of serving our vulnerable populations. So that's important to know. So our current system, when I talk about home and community-based services, we have within the Social Security Act what we refer to as 1915C. That's the section of the Social Security Act that currently funds home community-based services. We get $1 of federal and $1 of state, so it's a 50-50 match. And we've had that for about 30 years. It's a good program, highly regarded on the national level. We often are ranked within the top 5 in terms of just overall quality care. Our system itself, we take pride in. That's what we've had for 30 years. Well, it's a new day. We are proposing that we look at other options that currently exist within the Social Security Act. And those options are 1915K, just another section, and 1915I. So let's talk about K. The difference between 1915C, our current system, and 1915K is that we're going to be able to draw down, if we use this system, draw down an additional 6% federal match. So instead of dollar for dollar, 50%, it's 56% from the federal government. And with that, we believe we can bring in more finances, more revenue from the federal government to support our vulnerable populations. The system is really no different. So the 1915C is about integrating people into their communities and supporting them in that environment. It's the same thing with the K option. So put it simply, we want to go after the K option because of that additional federal drawdown. That's key. 1915I is an option where it's dollar for dollar, 50%. But we know within our world of senior and disability services that we have grant components that are pure general fund dollars. We know that within the world of behavioral health, within the Department of Health and Social Services, they have pure grant funded programs through state dollars. So looking at these programs, we believe that we can tap into 1915I and use that dollar for dollar match. So it's a 50% drawdown from the federal government. With the 1915I, we believe that many of our grant components within SDS, Senior and Disability Services, and behavioral health can be addressed through the use of that option. So that's key to remember. So I&K, 1915 I&K, we signed a contract with Health Management Associates. It's a national company. They have a strong background in Medicaid and Medicare. They have a lot of depth when it comes to long-term support services. And the options that I shared with you is about that. We signed a contract with them. We did that because we wanted a national entity to work with us in the development of this implementation plan around I&K. So the contract is in place. A part of the 1915K is that we are required to develop an implementation council. And this is a council of recipients that actually receive services or family members that have recipients receiving services. It could be your son or daughter or your parent that's needing those kind of services. But according to the Center for Medicare and Medicaid Services, specific to 1915K, we're required to put together this council. So we have 11 voting members of this council. They are from around the state of Alaska, which that's important. You have to have good balanced representation. So we have done that. Those associations that are tied to our world in terms of long-term support services, and there are a few, we have 8 associations that are there in advisory capacity. So the council has been in place since October. We've had a couple, we meet every month. We have another meeting next month, and we'll continue to have monthly meetings with this council up to the end of the contract, which will be the end of July of 2016. So all activity, all ideas, all design concepts in terms of how this would look, in terms of K&I, we bring that forward to the council for their review. So they're there in an advisory capacity. We consult with them. It's very important that we have input from the community around the state, and that council serves in that role. The length of the contract with Health Management Associates will go to the end of July of 2016. And it'll be at that time that the contractor, in working with the state of Alaska, will submit to us an implementation plan. So this will be kind of a high-level draft of what we believe I&K will look like in the state of Alaska. So that's critical and that's important. Once we get that contract or get that implementation plan, the state will have the responsibility to move forward with all the regulatory work that needs to be done, the design of the system, the operational design of the system within the state structure, the operational aspects to this system within the state structure. All that's going to happen from July of 2016 to July of 2017. During that time period, we'll need to go to the Center for Medicare and Medicaid Services to get their approval. All these options that we've been talking about have to be approved by the Center for Medicare and Medicaid Services. So once they approve that, which is a big deal for the state, we can then move forward with the actual implementation of the system. So our go-live date for 1915I and 1915K will be July 1 of 2017. In much of our discussions with the council and with members of the community throughout the state, they do believe that that's very aggressive. What I would say is that there is a sense of urgency given our fiscal climate, and we have to do something to be able to draw down additional federal dollars. We have to be innovative and creative to make that happen. So I know that I look forward to that as the Director for Senior and Disability Services. In our outreach to date to the communities, I think they get that. I think they know that we have a sense of purpose now to move forward and do what we can in terms of our home and community-based services program. Thank you.